Is it schizophrenia or late-life depression? Have you ever wondered how to tell the difference between schizophrenia and late-life depression in older adults? It can be quite tricky since both conditions share some similar symptoms. However, understanding their differences is essential for proper treatment. Schizophrenia in the elderly can be divided into two main types. The first is early onset schizophrenia, which continues into old age. The second is late onset schizophrenia, which typically begins after the age of 40 or even 60. This late onset type is sometimes referred to as very late onset schizophrenia like psychosis. Older adults with schizophrenia may experience a mix of symptoms. Some may have positive symptoms like hallucinations and delusions. Others might show negative symptoms such as social withdrawal and lack of motivation. Contrary to previous beliefs, many older patients do not show significant negative symptoms over time. It is also important to note that schizophrenia in older adults is often linked with higher rates of physical health issues and increased mortality compared to the general elderly population. While cognitive decline can occur, schizophrenia is distinct from dementia-related psychosis. On the other hand, late-life depression is quite common among older adults. Symptoms may include persistent sadness, loss of interest in activities, and cognitive impairment. Some individuals may even experience psychotic features like delusions or hallucinations. Late-life depression often arises due to stressful life events, such as losing a loved one or dealing with chronic illness. Unlike schizophrenia, late-life depression is primarily a mood disorder. The psychotic symptoms seen in depression are usually related to mood. Many older adults may not realize that depression is treatable and may mistakenly think it is just a part of aging. When trying to distinguish between these two conditions, there are key points to consider. The age of onset is one factor. Schizophrenia can begin early or late in life, while late-life depression typically emerges after the age of 65. The symptom profile is another important aspect. Schizophrenia involves persistent psychotic symptoms that are not necessarily linked to mood changes. In contrast, depression focuses on mood symptoms, with possible secondary psychosis. Cognitive effects also differ. Both conditions can lead to cognitive impairment, but the cognitive deficits associated with schizophrenia are usually more severe and long-lasting. Additionally, older adults with schizophrenia tend to have higher rates of medical problems and mortality compared to those with late-life depression. Treatment responses also vary. Depression generally responds well to antidepressants and psychotherapy, while schizophrenia often requires antipsychotic medications and comprehensive management. In clinical practice, a thorough assessment is essential to differentiate these disorders in elderly patients. This may include reviewing medical history, conducting mental status examinations, and sometimes performing neuropsychological testing or brain imaging. Recognizing the differences between schizophrenia and late-life depression is vital for providing appropriate treatment and improving quality of life for older adults. Understanding these conditions can help ensure that individuals receive the right interventions tailored to their specific needs.